Dr. Baliga here. This podcast is one in a series of 10 podcasts on medical ethics and professionalism from an outstanding chapter by Dr. C.Ronald MacKenzie, who is Professor of Clinical Medicine and Medical Ethics at the Weill Medical Center of Cornell University. He was recently named the C.Ronald MacKenzie Chair of Ethics and Medicine at the Hospital for Special Surgery, where he practices rheumatology, general internal medicine, and has provided perioperative care at this institution and at the New York Presbyterian Hospital for the last 30 years. By the end of these 10 podcasts, the listener should have a solid foundation in ethics and medical professionalism, and reading the chapter in the book, which is available at www.mastermedfacts.com, should set the candidate up for excellent performance in the internal medicine board review exam. Multiple choice question. In the teaching of medical professionalism, actions that are believed to enhance success include A. Setting of expectations, B. Providing experiences, C. Evaluating outcomes, D. Threat of penalties and sanctions, E. A, B, and C, and F. A, B, C, and D. The answer is E. Modern concepts pertaining to the teaching of medical professionalism emphasize three important actions, including setting of expectations, providing experiences that promote professional behaviors, and the evaluation of outcomes. The treatment of penalties and sanctions are not considered effective methods for the fostering of optimal ethical behavior. Teaching professionalism. The assumption that the process of medical training naturally imparts those qualities that define a good physician do not seem viable, if it ever was, to modern day medicine. Thus, in earlier eras, discussions of medical professionalism centered primarily on such matters as self-regulation, technical expertise, and knowledge. As a consequence of this orientation, mechanisms such as board certification and continuing medical education evolved to address these needs. Indeed, these approaches have been so successful at achieving their goal that medical education is no longer a primary consideration in discussions pertaining to professionalism in medicine. Rather, problems such as responding to the changing healthcare environment brought on by managed care, that is organizational ethics, the awareness of healthcare disparities, and the conflict of interest have dominated the discussion. Further, spurred on by recent studies suggesting that unprofessional behavior and the resultant need for disciplinary action for practicing physicians may have its genesis much earlier, as early as in medical school, interest in professionalism and how to teach it remains a topic of considerable attention. Among the leaders in the field, Stern and Papadakis have made particularly important contributions. In their conceptualization, the teaching of professionalism in medicine includes three primary actions: A. Setting expectations, B. Providing experiences, and C. The evaluation of outcomes. With respect to the setting of expectations, events such as white coat ceremonies and recitation of the Hippocratic Oath are traditional and common methods employed by medical schools to impart expectations pertaining to humanistic behavior in the practice of medicine. Further, the recent inclusion of professionalism as one of the 6 core competencies for residents training in the ACGME program is another important statement of support for these concepts. The Charter on Medical Professionalism and professional codes such as that of the AMA and those of subspecialty colleges and societies extend these expectations beyond the years of formal medical training. The provision of experiences is a reference to such activities as the inclusion of ethics and professionalism in the medical curriculum the development of problem-based learning, an approach that fosters teamwork and leadership, attributes relevant to professionalism, and such experiences as community-based and international electives that cultivate a broader societal consciousness. Finally, the evaluation of outcomes addresses the need to evaluate students to assess what lessons have been learned, as well as to formally emphasize the importance of learning them. Conceptual framework and the development of objective methodologies for the measurement of professionalism are currently a matter of great interest and active investigation in the halls of academia. Finally, the impact of role models should not be forgotten. In this regard, history has provided many examples of the ideal physician. Iconic figures such as Osler, Cushing, Peabody, and Penfield are a few such examples, as well as many less heralded individuals, those who have influenced each of us in the course of our professional development. While these relationships remain important, role modeling is apparently not enough, as research suggests that in order for role modeling to effectively impart principles of professionalism, these interactions must be combined with subsequent reflection on the action. Other important topics discussed in this chapter available online at www.mastermedfacts.com are common ethical challenges including confidentiality, informed consent, decision making, and best interest standard. It discusses withdrawing and withholding therapy, on medical futility. It discusses do not resuscitate orders. It discusses physician-assisted suicide and euthanasia, conflict of interest, allocation of scarce resources, reporting medical errors, and colleague responsibility and the impaired physician. The chapter completes with a quotation from William Osler, 1907. "You are in this profession as a calling, not as a business, as a calling which exacts from you at every turn self-sacrifice, devotion, love, and tenderness to your fellow men. Once you get down to a purely business level, your influence is gone and the true light of your life is dimmed. You must work in the missionary spirit with the breath of charity that raises you far above the petty jealousies of life." This podcast is one of a series of 10 podcasts derived from an outstanding chapter on ethics and professionalism by Dr. C.Ronald MacKenzie, professor at Cornell University and rheumatologist. This chapter should provide a solid foundation to the reader interested in medical ethics and professionalism.